All righty. Hello, everybody. Good morning and welcome to our Health to Hold webinar series. My name is Jenna Sistad. I'm the project manager for the Ocean Monmouth Health Alliance. We do this series once a month. And this month we have CentraState Healthcare System joining us to talk about American Heart Month and some of their heart health initiatives. So I thank you for being here. And I'm going to turn it over to Alex Novak. Thank you, Alex, for
Hi,
being with us.
thank you so much. Good morning officially. I am so excited to be here today to talk about my most favorite topic, which is heart, and of course, consumer education. So this is perfect day for me. I like to start off with some, data just to show the significance of why we care about the heart so much, why we stress over it. So it is the leading cause of death for women, men, and most of racial and ethnic groups. One person dies every 34 seconds from cardiovascular disease in our country. More than 500,000 people in the United States died from heart disease in 2020. That's one death. That's one for every 5 deaths. And coronary artery disease, otherwise known as CAD, is the most common type of heart disease. In America, more than 20 million people have coronary artery disease, and more than so every 40 seconds somebody dies or has a heart attack, and 1 in 5 heart attacks are actually silent, which means they don't feel anything when this is happening to them. So this is really important. And then, of course, we're going to talk about the risk factors of heart disease. And I'm huge fan of health prevention. So if we can do something on our own to better our lives for quality of living and prevent some of these things, huge, I'm a big fan of this. But some of the risks are high blood pressure, high cholesterol, high blood sugar levels, diabetes, smoking, being sedentary, overweight and obesity, excess alcohol intake, and of course, the genes that our parents have given us. Family history is really important. And a lot of us, I particularly didn't know my family history till recently. So I went out there and I spoke to both of my parents, got their information. So it makes me a better consumer of my health as well. The American Heart Association has so many wonderful resources, education for both us, the providers, and us as consumers of health, especially heart health. So I encourage everybody to go online and check it out. They really just want to help you live fierce. I literally copied it off their website. They want us to eat smart, move more, and be well. So anytime you have a moment, go on their website and check out some of their educational material. So they particularly broke down life's essential aids into our behaviors and into the actual health categories. So our behaviors are like smoking, exercising, eating right, and our weight. And versus our health factors are cholesterol, blood pressure, and diabetes management. And I actually like to highlight those 3 today, and we're going to go over them in greater detail. Also, I speak a little fast, so if you have any questions, I love it when people challenge me with questions, and I'll do my best to answer them. So let me know if there is a question at any point. So I'm very big on proper blood pressure checks. So a lot of what I see in clinics is that a lot of times I'll have a blood pressure log from a patient where we're trying to adjust their medications, or what we're trying to do is see if whether you qualify to take medications. And I'll send you home and I'll tell you, please go monitor your blood pressure. I'm sure you have done this before. And just the biggest and most important thing is to properly take that blood pressure. So we have to be sitting for 5 minutes on a chair with both of our feet touching the ground. And want to make sure that you're wearing a cuff that fits your arm properly. And it's not too tight, it's not too loose, it's the right size. It's on the left arm. And I see a lot of times people will go and get their cuff, which is upstairs. They'll run up a flight of stairs and then they sit down and check their blood pressure. That would be an incorrect reading, because as you're going up and down the stairs, your heart rate and your blood pressure would rise. So we don't want that. We want you to sit for 5 minutes afterwards and then take your blood pressure. Prefer that you don't smoke right before or have coffee before checking that blood pressure. And don't try to have a conversation with a family member who just got you upset and then you're checking your blood pressure. In general, checking blood pressure twice a day is more than enough. The more you check it, the higher it would go. So twice is more than enough, 10 hours apart, if you're trying to see if you qualify for blood pressure management as far as medications or changes in your blood pressure. But it's good to know that normal blood pressure is anything less than 120/80. So when you're looking at your blood pressure monitor, there's two numbers for your blood pressure, the top number and the lower number. And also the third number is usually your heart rate. The top number is your systolic blood pressure, and your bottom number is your diastolic blood pressure. If you want me to clarify what those numbers mean, please let me know. I'd love to go into greater detail. But if you already know, I don't want to waste your time by going over it.
Alex, I'm going to ask if you can just give a brief update about
Oh,
what
love
those
that.
things mean. Yeah.
Absolutely. So blood pressure is really the pressure of the blood as it travels from your heart that's hitting the blood vessels. So as the blood travels, think of it as a hose. As the water goes through the hose, the force that it hits the walls of that hose is your blood vessels, right? So as that force goes through, that's the top number. That's the systolic blood pressure. And once the heart pumps, so it's pumping, that's the systolic blood pressure. That's the initial force of that blood hitting the blood vessels. And then the heart relaxes. That's your diastolic blood pressure. That's the force of the blood going through the blood vessels when the heart is relaxed. And when it's relaxed, that's when the blood pulls into the heart again, and then it squeezes the blood out. It pulls and it squeezes. Is that good? Any questions? I'd love to clarify that anymore because I wanted people to really visualize this.
That was
Okay.
great for me, but I don't know if anyone else has questions yet.
All right. Elevated blood pressure really is 130/80, but blood pressure is also a little specific to our history. So really talk to your doctors. Sometimes your doctor will allow you to have a little higher blood pressure. And sometimes your doctor will really want you to be really below the 120/80. In general speaking, a blood pressure where the top number is 180 or the lower number is 110 or 120, that really requires immediate call to your doctor. If you cannot get a hold of a doctor, maybe go follow up in an emergency room. 180/120 blood pressure is really high. You should really go see somebody for that blood pressure, okay? And then why are we so stressed about and we enforce education about blood pressure? It's because it honestly affects almost every organ of our body. It affects our brain, can create a stroke, creates the blood vessels in our eyes. They're very small, can have vision loss, heart attack, heart failure, kidney disease, sexual dysfunction for men and women. Men have a risk of erectile dysfunction and women have a risk of low libido. So we try to really, really, really force that education and see what we can do to bring that blood pressure down, because we do not want to have multi-organ damage, right? So my biggest other part of my education that I do a lot is stress the importance of physical activity. When we walk, actually it releases the pressure in our blood vessels and that relaxes our blood pressure. Also, it makes our heart stronger, and so it pumps blood more efficiently. So I would say physical activity is one of the most important things that we can really do for ourselves and our body. And as you can see, it lowers the blood pressure from 5 to 8 millimeters of mercury. So that alone will lower your blood pressure. Physical activity is really walking. Just try to do about 90 to 150 minutes of aerobic exercise per week. But walking is aerobic exercise. I really want to stress that out. Sometimes I'll tell people to start with 15 minutes twice a day, and that's really a great place to start. And whether it's rain, shine, cold, please don't find an excuse to not go outside or exercise. It is so hard to exercise. So all excuses are very easy to find. Weight reduction is also really, really important. What happens is when we eat excess in calories, those calories have nowhere to go. An analogy I like to use is, let's say your car's tank is full of gas, and then I'll add more gas to your full tank of car. What we want to do is take the car out for a drive and then add more gas. So just keep in mind that we really want to utilize our calories as an energy source. So if we could either reduce the energy source or increase the consumption of energy. So either we use it more or we eat less. One of the recommendations, this is coming from American Heart Association, is a DASH diet. They really emphasize a diet rich in fruits and vegetables, and low fat products. Another diet that I find that is really popular and most people agree is very good for you is the Mediterranean diet. That diet really allows for people to have poultry, fish, once in a while, even red meat. And people like it because they can have a glass of wine here and there, but really it allows you to eat more nuts, more fruits, olives, olive oil. Those are really good and monosaturated fats. So we want more diet rich in that. Sodium intake, so salt. Our diets are so saturated in our salt intake because it tastes really good. One thing to keep in mind is that the more salt we eat, the more water will follow that salt. And then the more water that's in the body, the harder the heart pumps. So that's why we emphasize the reduction in salt. Our diet, like going back to it, is really rich in salt intake. One of the biggest things that I like to educate people on is that our white bread that we eat has a lot of sodium, our bagels. So what I do when I eat my bagel, I don't put salt in my eggs. I'll just have the bagels with the eggs without putting any additional salt. So if you can think about that and see where you can reduce that salt intake, is really beneficial for you. Another thing is if you can make your own chicken stock or vegetable stock instead of buying it over the counter in the supermarket. Deli meats, cheeses, ready to eat meals, takeout food, really high in salt intake. So if we can maybe substitute one a day to something that we made ourselves, or substitute the salt or remove the salt, is really beneficial. And of course, the stress importance of less alcohol consumption. So briefly also want to touch on high cholesterol numbers and what is cholesterol. Cholesterol is actually a waxy substance that is needed for our cells to make vitamins and hormones. It becomes a problem when there's too much of it. It can cause atherosclerosis, which can cause, as you can see that image, that yellow right there is actually the buildup of the atherosclerosis. And as you can see, much harder for the blood to flow if the blood vessel is narrowed. So our liver makes our cholesterol for us. Also, we get our cholesterol from the food that we eat. So meat, poultry, and dairy products are high in cholesterol. Anybody have questions so far? That's a lot of information. Everybody's good? All right, great. So when you go see your doctor, either your primary care doctor or your cardiologist, they may check your blood for your lipid panel, your blood work, and check your lipid panel. The things that the lipid panel is going to show you, it's going to show you total cholesterol. It's going to show you LDL cholesterol. When there's too much LDL cholesterol, it raises the risk of you having a heart attack or stroke. HDL cholesterol is another item that you will see on your panel. When those levels are high, they tend to lower your risk of heart attack and stroke. Also, it will show you non-HDL cholesterol. Basically, it's your cholesterol panel minus the HDL. Lastly, it will show you your triglycerides. Very important to note here that the triglycerides are not cholesterol. They're just another type of fat. And that increases risks of heart attack and stroke as well. So what would be our normal panel? A normal panel in general, we would like to see individuals who, this is a normal panel for people. I want to stress the importance here of saying this, who have no risk of cardiovascular disease or stroke, and for those that do not have elevated cholesterol, heart disease, or stroke. So this is absolutely textbook perfect numbers, which are very rare in real life. Total cholesterol, we want it to be below 200. LDL cholesterol, less than 130. And again, if somebody has history of coronary artery disease or heart disease, we want that number actually less than 70. And there will be new guidelines that are saying they want it to be less than 50. So really, really low on that number. HDL cholesterol, 60 or higher is good. The best way to honestly raise the HDL cholesterol is through physical activity too. There's really no other way in genetics. And triglycerides, we want those to be less than 150. And then I want to briefly talk about high blood sugar levels and diabetes, because it is also a risk for cardiovascular disease. Type 2 is the most common one. And again, risks of developing diabetes is obesity and physical inactivity, sedentary lifestyle. Untreated diabetes, again, can lead to cardiovascular disease. Risk of elevated high blood glucose levels, which is just blood sugar levels, can damage the eyes, again, because the eyes, blood vessels are really, really tiny, the kidneys, the nerves, and the heart. So if you have access with your physician, I don't know if you can, but if you can get a hold on a continuous glucose monitor, it's a device that you can see a picture there right here. A woman wearing a little, almost like a little quarter-size tag, and her phone is attached to it. She can actually see in real time if she, let's say, ate an orange, what that orange, how affects her blood sugar levels. I do this a lot with many individuals, and what we actually learned is that what raises my blood sugar level may not raise your blood sugar level. So it is so important to learn what works for you. Textbooks are great to have, but I find that not one rule applies to every individual. So if you can better learn about your makeup composition, of how your body reacts to certain foods, this is wonderful, wonderful tool to use, and you can actually modify your diets and enjoy food a little better, I think. We do this a lot. We've learned, and a lot of my patients, I've learned that, let's say, one of my patients, he loved to have his ice cream at night. We learned that if he moved his ice cream to the morning, it actually lowered his overall blood sugar levels. So like things like this are really good to know. Another one of my patients learned that the grapes that she ate every day caused her blood sugars to go through the roof. Yes, just eating grapes made her blood sugar super crazy. Another one of my patients learned that she can eat pizza because that barely touched her blood sugar levels. Again, it's really interesting case by case, but something fun to learn about yourself, and then you can enjoy food a little more. Peace, I guess, in peace. So cardiovascular disease, particularly coronary artery disease, going back to the first slide, is one of the most common heart disease in America. I want to briefly discuss heart attack and what it is. There's a picture right here of exactly what that looks like. So there's a plaque, that's the buildup in the blood vessels of the fats, cholesterols, sugars. That becomes a clot, acute clot. And what it does, it blocks off right here, supply of oxygenated rich blood to this part of the muscle. It could be this part of the muscle. This is just a picture. It could be that part of the muscle. And that's what a heart attack is. Basically, no flow to the certain location or part of the heart's muscle. When that happens, a person can feel nausea, vomiting, or heartburn, or burping. They can feel a very fast, uneven heartbeat, chest pressure, especially that's relieved with rest, is one of the red signs or red signals. Feeling sweaty or cold, being out of breath. Those are really good red flags to keep an eye out. If that happens, please call for an ambulance or 911. What we have here at CentraState, we have a fully functioning cardiac cath lab. So what we are able to do is look into the arteries of the heart, and we're able to stent it. We cannot do a bypass here, but we can refer you to have your bypass done at a different institution. What a bypass is if somebody has more blockages somewhere else, what they do is they open the heart and they create new bridges, new tunnels for the blood vessels that are already broken off. That makes sense? Everybody's good so far? Okay. After heart attack, after you got the stent in, what we like to do is have everybody go and exercise as much as we can. There is a cardiac rehab program. There is actually one here at CentraState as well. What that allows you to do is exercise safely under the supervision of the healthcare team. This way, a lot of people really learn how much they can push themselves afterwards and what limitations they have and what they can and cannot do. And after a heart attack, we really encourage significant lifestyle changes. Many people I find quit smoking, start dieting and exercising. And a lot of the times people will leave with 3 or more medications.
Alex, I'm sorry to interrupt you. Somebody in the chat wrote, are there multiple types when you were just going through the last slide? It was just a minute ago. So Karen, you may want to clarify in the chat or take yourself off mute and let Alex know, are there multiple types of what were you referring to?
Attacks to the heart.
Okay.
Like, in other words, you're just showing that there's blockages in the arteries. There are heart attacks that are non-blocked, and I wanted to know about those.
Heart attacks in the arteries of the heart. I'm sorry. A part of your question got cut off when you were talking.
Yeah, I was just wondering if there were multiple types of attacks of the heart. The example you're giving is a blocked artery. Yeah.
This is a blocked artery. There's also a heart attack that is not like a real heart attack. It's a stress-induced type of heart attack, like a broken heart syndrome. If somebody is under significant amount of stress in their life, they can actually mimic their heart feels like it's having a heart attack. We will go into their arteries and they're completely clean. But that can also be a heart attack. If that's what you're referring to?
Yes.
Yeah. So that's a different and specific type of heart attack. It's not really because of a plaque formation. That's really stress induced. And I can have a whole conversation on stress and how much it affects our overall health being and especially our heart. But yes, those kind of heart attacks happen. I've seen them happen a lot in a lot of women.
Yes, thank you for that. I just think we need more education in that area. People are unaware. So yeah.
Okay, great. So that's good for us to know. Maybe we can do this again and we can talk more about the broken heart syndrome. Yeah. And maybe how do we reduce stress and how we cope with that as well. I'm a really big yogi and a meditation. I love that stuff. So I can speak about that for a while. For a heart attack, the typical heart attack of blocked arteries, we find that women are women are really great about putting our feelings to the side, our pains and discomfort somewhere else. And we always take care of everybody else. So our symptoms are not exactly the same as to a man's symptoms. And I wanted to showcase that here and highlight that. So in addition to nausea, vomiting, and the left arm pain, and the jaw pain, and the chest pain, women can also be fainting. They will feel that they have indigestion a lot. They'll say I have GERD symptoms. And extreme fatigue for a woman. I know we're tired a lot, but this is a different type of tired. So I just really want everybody to be aware of these signs and maybe pay attention to ourselves a little more and not put it under the carpet or under file somewhere and put it away. I get that a lot. A lot of women wait till the very last minute. So the cardiac testing, in general, I like it when I have my patients go for a coronary artery calcium score. It helps to risk stratification. So what I'll do is I'll do a cholesterol panel and I'll do a coronary calcium score and see if we need to initiate medical therapy, what are the risks for you in particular and specific to you. But what that test is, it's a specialized CAT scan that measures the amount of calcified plaque. An echocardiogram is a great test to also get, especially if you're having some palpitations, if you're having shortness of breath, if you're having chest discomfort. It's literally an ultrasound of the heart muscle. What allows us to look at is how the muscle works and overall, how the function of the heart muscle, the walls of the muscles. Then it allows us to look inside the muscle itself at the upper and lower chambers. There's 4, and at the valves of the heart, which are the doors openings. And it lets us see if there's like a hereditary abnormality, if there is fluid surrounding the heart muscle, if there is a valve that's malfunctioning, and overall function of the heart. We want to make sure that the squeeze is proper to supply the demands of the entire body. A stress test is another great tool to use. What we do is we attach it to an EKG machine, an electrocardiogram that tells us the electrical conductivity of your heart, and we put you on a treadmill and we watch you run. We like to see you really stressed and run really hard. But that is really to a specific group of population that can run really hard. A lot of people ask me, well, I can't really run that hard and I can't go up on a mountain that hard. And it's really what's so great about this test, that it's so individualized, so that if you can go into 3 minutes, you can go to 3 minutes. If you go 6 minutes, you can go to 6 minutes. The test becomes really difficult after 18 minutes. And I think in 5 years that I've been doing this, I only had 2 people that actually finished 18 minutes. So again, it's so individualized, but it really lets us to see the physical strength as well as the strength of the heart, and the electricity, the electrocardiogram that it's attached to, it lets us see the electricity conduction of the heart. And if there are any changes, so this is very important to note, if there's any changes on the EKG doing the stress test, that lets us think, oh, well, you know what, maybe we should do further testing to see if there is any underlying cause of that, if there's blockages in the coronary arteries. So it's a wonderful test, and all it is just running on a treadmill. There's a more invasive test for a stress test where we give you a special medication that makes your heart feel like you're exercising, called a LexiScan, but it's not for everyone, and you don't need to do it you don't need to have it done all the time. The stress test just on the treadmill is sufficient enough. The coronary CAT scan is very close to what a cardiac angiogram would look like. We inject you with dye and we'll put you under the CAT scan, and that dye is just going to show us the flow of the blood through the coronary arteries. If there is any significant blockages, it alerts us about it, and then we can proceed further. And then again, just to let you know about specifically to the cath lab at CentraState, we do have a functioning cath lab for diagnostic purposes. So again, that's to see if there's any blockages and for an immediate heart attack. They also gonna have, for this month, they're also gonna have a wonderful conference by one of our 2 really great cardiologists here at CentraState. They're gonna talk, they're gonna do a Q&A. I'm gonna be there. I'm not sure if you guys can make it, but I think it's a really good way to learn more about the heart and ask really good questions. I like to tell people to please write down your questions, because we tend to forget things really quick. And then we leave and then we forgot what we wanted to ask. And Dr. Google is great, but I don't promote the use of Dr. Google. It's really good to hear from the specialists, and these 2 guys are really good. I'm getting to know them a lot here now, and really impressed with them. Any questions? I love questions.
I do have a question.
Please.
Talked about some of the initiatives that you guys have at CentraState, and I'm wondering, my mom has AFib. She's had AFib for a long time, and in 20 21 got an ablation to try and correct the abnormal arrhythmias. It did not go well for her to do that. And so I'll spare you the details, but are there other ways to correct fib besides maintaining with medication management or that ablation that are safer than like opening her up again? Because the ablation resulted in like an emergency open heart surgery because I guess her body didn't take to the ablation.
Right. So AFib is, so she gets really bad symptoms. She's very symptomatic.
Yes.
What medications is she taking for it?
I'll have to look it up in my notes as we're talking because I don't have it right on hand.
Um, so it seems like they kind of try to use all their tools in their toolbox.
Mm-hmm.
And if she's already a high risk for these procedures, you don't want to put her body through that stress again.
Yeah.
Many times, they can do cardioversions, when they just shock you.
Mm-hmm.
But it may just not really help her either, because those are not, they're a lot of times it's like a band-aid more than a fix for some people.
Mm-hmm.
So diet modifications, lifestyle changes can help her too a lot.
Okay.
But also maybe her medication needs to be changed if she's really symptomatic.
Okay. So she
Um,
also is long-term cancer survivor, so she takes meds for that too. So I think that comes into play. But
yeah,
propranolol, Eliquis, omeprazole, Calcitre, Zejula, and Multac are the ones that she's on.
yeah. So the Multac and the propanol probably more for her AFib, and then she has the blood thinner to prevent her stroke.
Right.
Yeah. So I'm not, I think the best thing to do is also to get opinion of, go see a physician, see the cardiologist that you see and see what else they may offer her if she is continuously being symptomatic, because I understand that will affect her quality of living.
Right.
So a lot of times I tell patients is that if you don't tell us, we don't know. Right. So you have to be a little bit like, okay, so this is also not working. And this is also not working. What else you got for me? Right.
Yes.
And also sometimes you want to go see what another electrophysiologist may say.
Okay, that's a good suggestion because I don't think she does that. She's a very good advocate within her primary and her cardio doc team.
Right.
But maybe, okay, if you have any recommendations,
Electro, yeah,
be a good.
I'll talk to them here, but and see if they have an electrophysiologist here. I worked recently in Morristown. I'm new for CentraState specifically, and I don't know all their physicians yet. But these two guys, so far, I've been working with them a lot, and they're great. But they're going to be discussing. It looks like they're going to be discussing what the mechanics behind your heartbeat. That might be a good conversation, or a good conference for your mom to attend to, so she can learn a little more.
Okay.
But an electrophysiologist, they're the specialists for the electricity of the heart, right? So the heart is really has many components. It has the blood vessels that sit on top of it, which are the coronaries. Then you have the big pipes that come off of it, the aorta. Then you have the actually muscle itself. Then you have the valves inside the muscle, the chambers inside the muscle, and then you have its own electricity. So it's really a complicated structure. And so right now where we live in New Jersey, we have so many specialists for each one of these components, and they're amazing. So an electrophysiologist is a great specialist to go see maybe for her if she hasn't seen one yet.
Okay. Thanks, Alex.
Yeah, you're welcome. Great question. I appreciate that. More questions?
I see another one coming down through the
Yes.
chat box. What is a more concerning prognosis for a patient? An elevated systolic, for example, on 160, or an elevated diastolic, which is 90 reading, for example?
Both are concerning. 160 over 90 is a concerning blood pressure. I get those questions a lot because some people will have either or. And that's why I say it's important to talk to the person who's been caring for you for a while and knows your history a little more. because sometimes we may allow one of these two numbers to be higher than the other for a specific medical issue or symptoms control. So both 160/90 is high for a general textbook, but sometimes we can get individualized care, which is what everybody should be getting, and we can make exemptions for certain people. So that would be a great conversation to have too with your point person, point provider, whoever you find that you trust most.
And Tracy, if there's more details behind that and you want to take yourself off mute and talk more directly, that would be great too.
Did that at all help you with your question, at least?
Oh, she's in a place where she's
Okay.
not able to talk. Okay.
No, yeah,
All
yeah.
right. All right. Well, thank you for the question. Does anybody else have questions for Alex today?
So just when you go back and you see your primary care, you see your endocrinologist, you see your cardiologist, it's a lot of different doctors to put them all together. The most important thing is really just to have the baseline numbers, right? To have your benchmarks, to really know what's happening. Because if you don't know what's happening, then you can't fix it or be on top of it. And then what ends up happening is that we get people with heart attack because it's already at the end. Really want people to think about what can we do to prevent from that getting there? What can I do before that has to happen to me? So diet, exercise, sleeping right, not smoking are the things that you can control and do on your own and promote your own health.
I have two questions. It's a two-parter.
Go ahead.
My name is Diana. Hi.
Hi, Diana.
So my mom has high blood pressure, and I ordered her a blood pressure machine to do at home. So she checks it every morning, and that's it. Do you think she should be checking it twice a day, in the morning and at night, or just in the morning is enough?
If the blood pressure is already controlled,
It is.
it's not necessary to check it twice a day. What happens? It's unnecessary. You should not do that. Once a day is okay for her. What you can do is, if you're curious to know how she does at night or in the evening time, is maybe tell her skip the morning. You know, you can do 3 days a week, Monday, Tuesday, Wednesday morning blood pressure, and the other days of the week you can do the evening blood pressure, just to kind of get an idea how she does at night.
Okay. Thank you. And then the other question is, the other question was, well, I don't know if it's a question, but on Sunday, she's sitting there watching TV and she's going, I got a pain right here she goes, where's my heart? So I told her, I was like, it's not where everybody thinks it's all the way up here. No, it's kind of like towards the middle, a little bit, one side, I don't know, but it's not where you're putting your hand. I said, if it's above, like right below your neck, like right here, I said, I think that's more like maybe electric kind of thingy, that sometimes we women with breasts, men too, but mostly women, maybe that's that. She goes, I don't know, it hurts. I said, is it a muscle? Is it whatever? So I told her to check her blood pressure, and we checked it, and it was fine. It was more than fine. But me, the paranoid person, I'm checking in on her all night. I'm like looking in, and it
caring
turns out
daughter. You're the caring daughter.
I'm a little too much though. I'm like,
it's good to be that way than the other way.
Oh, well. So yeah, so I didn't want, and I told her, I said, if you're still having pain, I'll take you to the hospital. It's not a problem. It's a quiet Monday evening. Let's just go to the TV.
I couldn't agree more with you.
She refused.
So the heart would be exactly on the left side. You can actually sometimes, if you quiet down your breathing, actually hear it and feel it. To quiet down your breathing, how do you do that? Sometimes people may like to hold their breath, but you can think about a box breathing exercise where you're breathing 1, 2, 3, 4, exhaling 1, 2, 3, 4, and then you can kind of quiet down your breathing just to kind of learn. But that's where the heart is, but you can actually feel it and hear it sometimes. if she's, so the big thing that another red flag that I probably should have talked about is that, let's say you are exercising, because I get a lot of people who are avid athletes and they also have coronary disease, and that's because their family history, right? Can't run away from the genes that we were given. So they will be exercising, they'll be running, and then they'll get pressure in their chest. And when they rest, that pressure goes away. That's a big red flag. For us, when we're sitting and we're getting some chest discomfort, like I said, some women have different presentations, really weary and cautious about women. So if she's continuously having some discomfort, I would probably go and have a cardiologist do any of these tests that we've talked about. She can do a CAT scan of the coronary arteries. She can do a stress test, right? She even get an echocardiogram to make sure the function of the heart is good, that there's no damage to the heart muscle. So those are the things that she probably should be doing anyway. But this is a good thing probably for her to get checked out.
Okay. Thank you.
Yeah.
She's had echocardiograms before, a stress test. She's had that, and it always comes back normal. She's fine. Yeah, I think
she has a caring daughter that cares.
Too much. I think too much.
No, it's a good thing.
Thank you.
Good stuff, Diana. Get Mercedes in check, would you?
She's gonna give me a heart attack.
I know. Anything else for Alex? Any other questions?
Any preventative disease questions? Any more other questions on heart disease that we didn't cover? Or you've been wanting to know for a while?
Okay. All right. Well, I'll take the silence, and I don't see anything else in the chat, as that we've learned a lot and we don't have any further questions. So I just want to close by saying thank you again, Alex. This was wonderful. Like I said, my mom is affected. You hear, other participants work with clients or have family members who have issues with their hearts. So, I think this is something that everybody. An excellent opportunity for us to learn. So thank you so much for joining our Health to Hold webinar series. And just as a reminder to everybody on the call, our next one will be on March 22nd. It will be at 10 a.m. and we'll be hearing from the Parker Family Health Center about colorectal cancer prevention and
that's a great one
that they have happening in Red Bank. So thank you, everybody.
And thank you guys for including me on this.
Take good care, everybody. Thanks so much.
Bye-bye.